In Atlanta, Georgia, a number of civil rights leaders have stepped up to the plate to fight silica fluoride in the drinking water. It's a civil rights issue. You have injury to their children, they're fighting it because they don't want their children to be injured by silica fluoride any longer.
First of all, I had very little knowledge about fluoride in the drinking water. As most people in the African American community, we are not familiar with this. Most are still not familiar. But a friend of mine named Laura Seidel, who's very much involved with Captain Planet and many of the environmental issues around the country, called me and asked me would I meet with a man named Daniel Stockton and another person from the Lilly Center. So myself and Ambassador Andy Young met with them, and we looked at much of the information. We looked at what fluoride was doing to the teeth. We heard a lot of the information about this particular ingredient in our water and in our toothpaste. So consequently, we began to do a little more research on it, and we wanted to know how did it disproportionately impact on the people that we're called to serve in the African American community.
I found this water. There's some waters that are available out there today. And for instance, this is a bottled water that is sold for use in preparing milk formula and for babies. And the thing about it is that if you happen to be someone who can't afford to buy this bottled water, perhaps you're a member of a minority community who has a lower household income, what are you supposed to do? Do you not count? Do you not matter? Does your babies not matter? So I saw a whole series of issues, particularly about disproportionate harm to minority communities. And this really pricked my conscience, and I couldn't be quiet about it. And that's why we really began to reach out to members of the Black community and Hispanic community to talk about harm from fluorides.
We are chemical systems. Toxins have such a huge effect on human behavior. And it's really important to understand this because the silicofluorides increase the absorption of the toxins. Lead levels absorbed by blacks in the United States are higher than lead levels absorbed by whites. A survey of children's blood lead, that's called the National Health and Nutrition Evaluation Survey data set, counties over 500,000 population, big cities. And if you look at this chart, you'll see that these are the blacks, these are Hispanics, and these are whites. And this is where there is no silicofluoride in the water, and this is where there's silicofluoride in the water. And you'll notice that there are two things that are going on. First of all, the blacks have higher levels of their lead than the whites, and where there's silicofluoride, there's higher level. But there's a third thing, which is the difference between these two graphs is bigger for blacks than it is for whites.
There's many different health effects that show up from fluoride. I think Dr. Yamiana said there's something like 30 enzyme systems that are affected, but the most obvious one is the dental fluorosis. Surgeon General of the Public Health Service was asked to give advice on the subject, so he formed a committee on non-dental effects. He had one on dental effects and one on non-dental effects. When they met, they discussed dental fluorosis and said that you'd have to have rocks in your head to allow your own kids to get dental fluorosis.
Well, I became interested in the issue of disproportionate harm to minorities from fluoridation for several reasons. First of all, as a public health professional, I had done some minority health work in my career. I also saw in a publication called Morbidity Mortality Weekly Report from the CDC, in 2005, they had some information that they shared. Buried in the back of this study that they published was a little table, and it showed that Black Americans and Hispanics had disproportionate amounts of dental fluorosis. And I was intrigued by this and disturbed by it, actually.
I was asked by my supervisor to find out why children who are Hispanic and Black have higher levels of lead in their blood than white folks. It turns out that there are alleles that control the amount of material that is absorbed, such as lead, arsenic, heavy metals. Black children have two alleles that increase the absorption rate. Hispanic children have one allele that does and one that doesn't. And Caucasian children have the slowest rate of absorption. I found that extremely disturbing, and I wrote several memoranda suggesting that the levels we were setting that were acceptable of lead were unacceptable for blacks and for Hispanics because they would absorb more given the same exposure.
And what a lot of people don't understand, because why would we know about this, is that alloys in brass and bronze and things like this, some of our plumbing fixtures, these plumbing fixtures have lead in them. And sometimes our plumbing lines have lead in them. So the fluoridated water, in some instances where there is the right chemistry in the water, can actually pull lead into the water. The fluorides can help pull lead into the water. So, maybe it's a little bit of lead, but the point is that any lead at all, this is something your body doesn't need.
It's been stated to me that if we come out and speak about these issues in terms of fluoridated water and the impact, that there might be people in higher up positions that might become somewhat angered, disgruntled. People might say that they don't have all of the facts, and I wouldn't argue with that. We don't have all of the facts, but they said that if you begin to speak out against this, it might get a little heat might be put on you. And I said that if you can't stand the heat, you need to get out of the kitchen. And I think that that's quite important, that for those of us who are beginning to try to understand this, that we raise the pertinent issues that can improve the lives of our children and those that we're called to serve.
Why has the public health community, and why has the medical community and the fluoridation, the supporting community, why have they not actively shared with minority communities the whole story about fluorides? If fluorides are so safe and good and mom's apple pie and all American, then certainly they would stand up to some kind of scrutiny and closer examination. But when I began to address minority health departments in government agencies, I, for instance, in the state of Tennessee, I was told that the minority health folks would not talk to me anymore. And then we began to approach this issue with the Centers for Disease Control and other places around the country. And over and over and over again, we found out that when we posed the question about how do we reach out to the black community, how come the black community hasn't been told, the leaders of the black community, etc., we got silence, or they changed the subject. Even United States senators and representatives wouldn't pursue this subject. It's one of those things that nobody wants to touch with a 10-foot pole, because the facts are minorities are disproportionately harmed by water fluoridation and other fluorides from other sources.
We as a people must be concerned about the welfare and the health of all people. There are certain issues that tend to get swept under the rug. We've got to lift the rug, look at these issues for the good of the people. One of those is fluoridated water and what's in water. And we've got to, in some way, get all of the research necessary and remove it if it is detrimental. I tend to believe that it is harmful. So if we're to make a difference, we've all got to come together. We've got to come together as parents. We've got to come together as clergy. We've got to come together as science. We've got to come together as legislators and medical profession. We've all got to come together. And if we all can come together around this issue, we can find out where the truth is. And if we can find out the truth, then we can make a difference. And I think that that's what we're all called to do. I think everybody in this, whether they're on one side or the other on the issue, we're all concerned about how do we become a healthier people who can really have a beautiful smile like this.
There is very little information that is made available to members of the minority communities. And let's be honest about it, there's perhaps less access to computers, or maybe less access to the internet. And maybe there's issues with second languages and primary languages. So my concern was, we're all Americans, and it seems to me that all Americans deserve to hear the whole story about fluorides, not just the benefits, but what about how this affects members of the black community, or Hispanics, or American Indians, or other or Asians. So we began to push this story, and over again we met with resistance. The good news is the thing is cracking open now. members of the Hispanic community and the black community have been given this information, and they're waking up to it and saying, this is just not right. What are the people in our community supposed to do who can't afford unfluoridated water? What are they supposed to do if they can't afford to fix their teeth from the damage that fluoride causes to their teeth? Some things just need to go away. Fluoridation is one of them.